Welcome to Visionary Doc, where ambition meets purpose and self-discovery fuels transformation. Are you chasing success but feeling unfulfilled? Delve into the joys and jolts of high-achieving lives, and together, let's redefine ambition. It's time to strip away the pathological and embrace the potential. Join host Dr. Shehz as we explore what it means to be a visionary of your own life.
I'm your host, Dr. Shehz, and we have Francesco Carones. Dr. Francesco Carones here is my guest, and he is a world-renowned refractive surgeon based in Milan, Italy. Dr. Carones, it's a pleasure having you here, sir.
It's a pleasure for me being here with you.
Thank you. And, we can start with just telling me a little bit about yourself, Dr. Carones. I read a lot about you, and I have kind of just a preparation for this. And so, you had mentioned that your father was a ophthalmologist, and
Correct.
there was a part of you that initially kind of resisted, being a shadow, I guess, in your father's
Correct.
umbrella. And I can relate to that in so many ways. So we'll get into all of that, but why don't you just give us a brief introduction of who you are, what you do, and yeah, we'll go from there.
Well, let me start with the story about my father, because I think it's a nice way to start with. When I much younger, I wanted to be a doctor, but not necessarily, or I was fiercely opposed to be an ophthalmologist, because I didn't want to live in my father's shadow, as you were mentioning earlier. So my original idea was to do some heavy, aggressive surgery, like a cardiac surgery, like, those surgery where there's a lot of blood, efforts and all of that. And then at the second year of my university, I attended the first autopsy, and I passed out during the autopsy. I was so disgusted that I could not stand it. And then I did the second one. It happened again. I went to the first surgery and I attended it, and the blood made me sick. The view of blood made me sick again. So at some point I was desperate, because I realized that anything that was invasive in terms of view was not for me. And so there is where my father jumped in and said, listen, why don't you come and give a try to ophthalmology, given that you don't see blood, it's all done with a microscope and all of that. And so I went with him in his OR and attended a few surgeries, and I didn't pass out. So I was just being able to find a way to do it, to be a surgeon in a field that I was not expecting to be, but that was the real reason for me going that direction.
That is so funny, and I can relate to that so much. I mean, so for you, it was like, man, I want to do something like really heavy, like cardiothoracic surgery or something like that. But then it's almost like you found this like cheat code, right? In ophthalmology.
Exactly.
Hey, I'm still a surgeon.
Exactly.
I love that. So for me, it was neurosurgery, right? I wanted to become a neurosurgeon.
Okay.
And for me, it was because, a lot of reasons, but there's like that ego, right? Of like, oh, you're a brain surgeon. Oh my goodness, right? Just to prove something to someone. And so when I started going down that road, I realized, oh my God, 7-year residency. Well, hold on. I don't know if I wanted that bad, right? Took a step back. And then I explored different options, found ophthalmology, and kind of fell in love almost in a very similar way that you're talking about, right? Where it's like, man, this is kind of a hidden gem, right? It's still surgery, but without all of the negatives of the other, surgical subspecialties, right?
Exactly.
So,
and then I have to say that I found myself very familiar with the surgery, which is not really relying on your hands, but more on your brain, because I've been involved in refractive surgery since the very beginning of my career at the department of the university where I was working. Refractive surgery was launched where I was attending the first years. So I became almost immediately the chief of refractive surgery at my department. And this is where all my career has been done through.
Right.
And I always say that refractive surgery does not rely on your hands. It relies much more on your brain. So it's a surgery that you have to plan. And the best surgeon is the one doing the same, always in the same way, with the same times. You see what I mean? There is not a lot of creativity.
Absolutely.
But
Absolutely.
this is my brain. I mean, my brain is more on the schematic, very, strict to rules.
Yeah.
So I'm not really a creative person from that point of view. And really, refractive surgery is really like that. It's planning, doing the same thing in the same way, acting always in the same timings when doing surgery. There is where your outcomes are more consistent. And I was at the university department for about 10 years after my medical degree. And then I decided to go privately because I felt some sort of limitations as regards the availabilities that I could offer the patients as choices. The department of the university was a public one. So the options to be offered to the patients were a few, like we were not doing LASIK because it was too much of a cost for the hospital. And so we used to do only PRK. And the same is for all the other refractive procedures. I mean, phakic IOLs were not intended to be performed. Cataract surgery was just cataract surgery, not refractive cataract surgery. So at some point in the year 2002, I moved away from the university hospital and going fully private.
Yeah, and you mentioned, like, in that journey, you mentioned that refractive surgery kind of really became your sole focus, right? And I want to talk about that because it sounds like for you it was just this, you're a logical, analytical person. That's how your mind works. And so you gravitated towards that naturally. But there's this concept of focusing as an entrepreneur, right?
Mm-hmm.
I am an entrepreneur who is kind of afflicted with shiny object syndrome, right? I have so many different ideas and I kind of want to do everything all at once. But I've just realized through a lot of, kind of life experiences that in order to be a good entrepreneur, you have to focus, right? Be really, really good at one thing and be an expert in that one thing. And so how much of your decision to really lean into refractive surgery came from that mindset of being an entrepreneur? I'm going to focus on this versus this is what I enjoy. This is how my mind works. And so I'm going to stick with it. And then the entrepreneurship of refractive surgery just kind of formulated later on in life.
I would say that my approach with the entrepreneurial world came after my dedication to refractive surgery. Because remember what I was telling you, I started being a hospital surgeon.
Right.
So not a lot of possibility to have entrepreneurial attitudes. So I would say that what triggered my entrepreneurial aspect was more of the moving on the private practice, because there is where you can take your decisions and you can really optimize your everything. I mean, your patient flow, your job, your choices, but also your dedication to these, collateral activities that are part of the entrepreneurial world. So to me, it's refractive surgery came first, and then the entrepreneurial aspect came second. I have to say that in this path, at some point in 2015, I made a lifetime experience at the Kellogg with this program for physicians that opens your entrepreneurial aspect. And the program is called Physician CEO. I don't know if you ever heard about that.
Yeah, absolutely. Yeah.
That was a brain-changing experience, leading my early entrepreneurial attitude to a much higher level. Let's say that before that, everything was just focused, or not just, I don't want to be reductive, it was focused on how to improve my patient's flow, how to do my patient outreach better. So everything was really focused only on the business aspect.
Sure.
Let's say that I learned later that being an entrepreneur and having an entrepreneurial aspect or a mindset involves every single day, every single aspect of your life. So it's not just focused on your job, it's more on challenging many other aspects. You
It's
see
a lifestyle. It's a lifestyle.
Exactly.
Yeah.
It's way more like a lifestyle. And this second aspect of my entrepreneurial attitude happened really when I attended this course at the Kellogg School of Leadership.
Wow, that sounds like an amazing program. And I completely agree with you. Entrepreneurship is a lifestyle. One of the things that I've learned is, my whole life, right? You think entrepreneurship, you think money, right? Business, money. But what I've realized is honestly, time is our most precious commodity, right?
Yep.
Not time and autonomy. Those are the things that really entrepreneurship buys you. It's not the money. The money
Exactly.
comes, right? And so like, mentioning entrepreneurship as a lifestyle, like sometimes I will, even if it's like a 3 or 4 hour long drive where I need to go somewhere, I will Uber there instead of flying,
Right.
right? So I'll pay somebody to like drive me there because I get a focused 3, 4 hours to get work done,
Yeah.
right? And when you're flying, you got to go to the airport, you got to, find your terminal, all these things. And so it changes how you approach everything in life when you really adopt this persona of being an entrepreneur.
As regards to time, I'm 100% on your page. I mean, it's critical. One of the things that I learned immediately at Kellogg was the 168 rule, which means that in a week, there are 168 hours. And whatever you're going to try to get more, you're not going to get more. So it's more a matter of assigning this 168 hours in all your attitudes or things that you have to do. I mean, you also have to sleep at some point, but you know what I
Do
mean.
you though? Do you?
The proper assignment of these 168 hours is critical for your life. I mean, it's not just work; it's everything. It's the holistic way for seeing your life, which is a job, but it's family, it's recreation, sleeping, everything. So you have to squeeze no, you cannot squeeze the time. You can squeeze your attitudes. You can squeeze your tasks to fit this magic number. You cannot do the opposite.
And so how do you allocate your time now, right? Now that you kind of, think as an entrepreneur in every aspect of your life, how do you divvy up your time? Where do you spend your time most, where it's effective the most?
Right. So I am a morning person. In other words, I very much like to use my brain, work in terms of intellectual work early in the morning. So I usually wake up like 15 to 5 o'clock to be on my working place, which is where I am now, around 6:15, is to be able to do all the, as I said, intellectual work when nothing else happens. And then I have my clinical work or surgical work, which starts much later. So we never start working before 9 o'clock. So whatever happens in between 6:15, and 9 is where I dedicate more of my entrepreneurial attitude. Okay. Moving this, jet lag to that part of the time, the time frame, I get home like 7 o'clock, not later than that. And I like to spend the rest of the day with my family. I have 2 young children, given my age. They are 9 and 10, and they keep me young from that point of view. Because
I love it.
I have to go and play soccer with them as well. So this is something that I like to keep on doing because, as I was telling you, I like to see the life in a holistic way. It's a circle. Every single piece of the life is important, and family is very important. So if it is not brain, if it is not clinical and surgical work, it's family. This is my daily routine.
Man, I love that. You have to spend your life in a way that keeps you fulfilled.
Exactly.
And I completely agree. For me, it's family and work as well. You mentioned you were in the hospital setting first, right? And then you switched to private practice. And you mentioned some barriers and things like that really, you faced in the hospital world. So one of the things I love about entrepreneurship is freedom, right? It really allows you to have freedom and autonomy, in how you want to live your life and how you want to carry out your purpose in terms of your profession. So can you just speak a little bit about that? How did you think about that pivot in terms of, I really want freedom to do things the way that I want to?
Right. Yeah, sure. I think it's very important. I mean, freedom is critical, especially when your ability to use your freedom may be associated to your goals and the targets that you have, for instance, in your work, in your profession. So we started talking about refractive surgery. Refractive surgery is elective surgery. My priority and the reason for leaving the hospital was not being able to give patients enough service, where service means options, but it also means the customer care that the patient invests in money and emotions in something that can bring him or her something very special, like the gift of seeing without spectacles, and so involves. So I used my freedom and creativity in developing for the patients a journey for enjoying the let's say medical and surgical aspect related to refractive surgery. So I really try to focus very much on the ability and the possibility through the freedom to reinvent a way for consulting patients and making this journey like a real experience. Does it make sense to you?
Absolutely.
That was my main goal, my main focus. So my practice and what I developed using the freedom to be able to choose, strategic decision to face strategic decisions was very much on the let's set up a building, a practice, a staff, let's say a journey, as I was telling you earlier, that can be very patient-friendly.
Why is that important to you?
Because I feel very important for patients who have to take a decision, which is a customary decision, it's not mandatory, to take the decision in the best possible way, which means very relaxed, not with the pressure of, well, the doctor is here and I'm here, and so I have to take the decisions that he or she is taking for me. So the experience I am offering the patients today is more on the friendship. So we really try to have friends as patients and not customers. And I'm not saying that I'm giving patients the possibility to take decisions that are not aligned to what is best for them, but I really like for them to understand why we are going to a specific direction in terms of a decision, or even if the decision is not the decision that they wanted to have, like I want to have refractive surgery and the patient is not a good candidate. I like to explain them. I really like to give them a way for being thanked later, like, oh, thank you for what you have been doing, not as a doctor, but as someone who I feel I could have been speaking like a friend and not like a doctor.
Man, there's this concept of the hero's journey, and I think I've seen your wife comment about this, but basically if people can understand that we are not the heroes of this process, it's our patients.
Exactly.
Right? And the way that you think about this is so beautiful because you humanize our patients. Like they have a brain, right? And the onus is on us. If we can educate our patients, then we empower them to make decisions as well. We're guiding them, right? And within the framework of clinical medicine to make sure that nothing egregious is being done. But as long as nothing egregious is being done, it's their money, it's their choice, it's their freedom, it's their vision, right? And so I love how, as surgeons, sometimes it can be like, oh, I'm the surgeon, I'm the doctor, and so I'm up here and everyone else is below me. But I like that how you kind of level the playing field, right? Hey, we're all in this together. Let's figure it out together.
Right.
It's a beautiful mindset.
And without the freedom of making choices, that would not be easy. This is why I'm still reinforcing the concept that you have to lead your path. And if you are not an entrepreneur, you cannot really lead your path. You have to follow someone else's path. You see what I mean?
Yes. Being an entrepreneur is fundamentally charting new territories,
Exactly.
and you have to have the courage to do that.
Exactly.
Oh, why, do you think, why do you think there is this kind of, I don't know, hesitation maybe in our field, not just ophthalmology and refractive surgery, but I guess medicine in general, right? Where people are hesitant to take on this journey of being an entrepreneur, you know?
Yeah, I know what you mean. First of all, because being an entrepreneur means investing a lot of things, not just money. It means
Mhm.
investing time. And we were discussing earlier that time is more important than money. It means
Mhm.
challenging yourself on maybe areas that you did not study and you're not very comfortable with, which I think
Mhm.
is one of the most important reasons for doctors not challenging. I mean, doctors are always very much challenged by the patients.
Mhm.
You see the point where I'm trying to go, right? So the patient is someone who needs a doctor, but the doctor is always under the spots in the patient's view, meaning that
So you're saying the doctor's always under the pressure.
exactly, that's the
Right.
right word that I
Yes.
was trying to find. So
Yeah.
doctors feel a lot of pressure, and all that is happening now as regards, the crisis of the doctors who are,
Right.
being in the position of leaving their work or so,
Yeah.
testifies for this pressure.
Burnout. Absolutely.
Burnout, exactly.
Yes.
That's the right word. Being an entrepreneur adds more pressure, which means, in other words, that besides what you're already feeling as a pressure, you have a second, or third, and a fourth reason for feeling under pressure because of the investments that you're doing. And again, not necessarily monetary investments. So I think that doctors are reluctant in investing because they already have a lot of pressure and they don't want to have more pressure. It is easier to say, you know what, I'm working for that company, I'm working for that university, I'm working for that place where I get a salary and I don't have to worry. I don't have to invest more than I'm already investing.
Mm. Well, there's pain on both sides, right? I mean, you
Yep.
felt pain of being in the academic environment and not having the autonomy to practice how you want to practice. I've experienced burnout myself. I felt the pain of just being constrained, right? And entrepreneurship for me was the way out, right? I realized that for me, it was a little bit different. I realized that, in order to, if I'm going to be in this rat race and it's all about money, money, money. Okay, well, you know what? How do you take money out of the equation? So for me, it was, getting my time back through real estate investing. It was passive income, right? So if I don't have to worry about paying the bills and supporting my lifestyle through my chosen career, then I can practice medicine in the way that I want. I don't have to, I don't have that external pressure of having to provide and money and things like that. So that's the way that I approached it. And that's how I got into entrepreneurship. But either way you look at it, there's the pain of being in your current position, and then there's the pain of learning how to be an entrepreneur. Which pain do you want?
Yep.
Right?
Yep.
And how do we make it so that we make doctors understand that actually it's not that painful to be an entrepreneur? It's just understanding what it is that you truly want. How do we lower the barrier?
I completely agree with you. So I had my decision to be taken pretty much in the same way that you had, but commenting on those who are a little bit more scared and skeptical about, being an entrepreneur. I really think that the reason is I don't want to challenge too much. I already have way too many challenges in my
Mm,
life, in my career, and I don't want to take one more. And
mm,
doctors are at that risk just because they have a lot of pressure. This is my idea.
mm. Hmm. Very interesting. Let's talk about entrepreneurs. I love this concept. I can't wait to be there next year. I'm really looking forward to it. Do you have anything in mind for entrepreneurs, just in terms of how you want your community and that entire meeting to progress over the years? Where you're inviting people who kind of get this concept of entrepreneurs, I'm guessing, right? But
Mhm.
also inviting those who perhaps haven't thought about it in this way, right? Who are maybe where you were years ago in that academic environment, right? And you really want to invite them, hey, look, come to our side, right? The world is much better here. You have autonomy, you have freedom, all the things that we're talking about. How can we recruit those that feel stuck and show them that this is the way?
Well, let me explain you a little bit more about
Yes,
entrepreneurs because the idea and the, let's say, the full concept is based upon two different pillars, let's say.
sure.
One is developing private ophthalmology in a better way. But most important of this, the second pillar, which comes the first then, is how to make our patients' life better.
Mm,
You see the point? So
absolutely.
the idea of the ophthalmologist was born because we feel that patients are somehow a little bit, let me find the best word in English, penalized
Mm,
when they are not given all the possibilities that an entrepreneurial medicine can offer,
mm,
especially in the field of, ophthalmology and refractive surgery, where the word refractive expands to cataract.
mm-hmm.
I don't like to call cataract surgery as cataract surgery. I like to call cataract surgery as lens replacement for cataract, because what we do is not just removing a lens, is changing patient's life with the choice that we are making.
Absolutely.
And
We,
there is where, unfortunately, private medicine has more opportunities than public medicine, just because of the limitations in budgets that the national health systems have worldwide. So the idea is grouping together ophthalmologists, but also all the other stakeholders who are administrators, who are technicians, who are optometrists, who are investors, who are companies, industry, under the same umbrella.
mm,
Because there is a huge opportunity to work from all these different sides, for all these different perspectives, to improve what we deliver to the patients.
mm,
Okay. So the idea of entrepreneurs is not just to have a meeting, and it is not just to develop like didactic material on how to perform better or give patients, a better, education on ophthalmology. And so the idea is, give you the idea, having the industry get into the entrepreneurs and asking the entrepreneurs who are the ophthalmologists I, as an industry, can work with, maybe to develop a new lens or, start thinking of a new procedure, another perspective. If I'm an investor and I'm a private equity and I want to evaluate whether or not to open centers in Italy, I may want to go to the ophthalmologist because I can have indications on where are the market opportunities to develop that. So this is why I'm saying it's not just grouping people for a meeting. It's more, engaging different stakeholders to a final target that at the end should be providing better services to the patients.
it's an ecosystem that you're building. It's
Exactly. This is what we're trying to do.
It's a movement and an ecosystem that you're building so that if anyone is interested in learning how the business of ophthalmology can be applied to improve the lives of patients, that's where they go.
Exactly. This is our purpose. When I say our, because you know that my wife Amanda plays a
Yeah,
lot of role with it as well. So, but
yeah.
our goal is not just to have a very nice meeting every year. Our final target is developing a community that may help all the stakeholders providing better services in medicine as regards ophthalmology, to have patients being happier at the end of the day.
It's beautiful. I think the best work is done when we stop thinking about ourselves and think about those that we're serving.
Right.
And when you're keeping the patients in your line of sight, pun intended, I think only beautiful things can happen. So kudos to you, sir. I love that. Just to back up just a little bit, and then we'll wrap up here because I've taken a lot of your time. Thank you so much.
Pleasure.
You know, it's hard to change people's minds, right? It's hard to change our own minds because once we get stuck in our certain ways and habits, we like that, right? Change is uncomfortable. In your journey of becoming an entrepreneur, what was something that was really, one or two things maybe, or just one thing that was really difficult for you to wrap your mind around that was just like, man, I don't know, this feels weird. This is not how I'm used to doing things. This is not how I think things should be done. But you had the courage to just listen, adapt it. It turned out to be for the better, and then you changed your perspective of your mind about something. Was there anything like that that was really difficult?
Yeah, sure. I can tell you an episode as well, which was really kind of changing the perspectives to me. And keep in mind that Italy is a little bit different from United States. Usually, ophthalmologists in Italy do everything because we don't have optometrists. So
Sure.
even like prescribing glasses is to be done by ophthalmologists.
I think.
So traditionally speaking, ophthalmologists in Italy were like, how do you say, general doctors, like
Primary care doctors or
primary care doctors, exactly. So there was, historically, the doctor was the one explaining everything to the patients in the idea that the trust in between the patient and the doctors was built on the relationship in a one-to-one direction only.
Sure.
To perform better from an efficiency standpoint, but also to give patients a better experience, at some point I was advised not to be the one giving explanations, doing patient education and all of that, because there is plenty of evidence that doctors are not good communicators, and the accuracy of the communication that doctors have tends to decrease as time goes by. So I was suggested to have our technicians talking to the patients to educate them, just because this would also break the barrier between the doctor on the pedestal and the patient at the lower level.
Absolutely.
And that was in something that I was very reluctant to do. I was thinking that by doing this, I would alienate the patients from my practice, having less time spent with them by myself, which is totally wrong, was totally wrong. I mean, not only my practice became more efficient in terms of numbers and revenues when I started delegating part of the job. You were telling me time is most important, and time in the surgery is even more important. So if I was able to dedicate more time to the surgery that my technician would not be able to do, is to have them doing the pre-op evaluations independently. But also we had way, a better feedback from the patients in terms of, relationships, because of this barrier that was broken, having them to deal with people that were not the doctor, but someone that they started considering not really involved in the economics, not really involved in the, well, maybe the doctor wants to sell me something that it's not really adequate to me and all of that. But as I said at the beginning, I was really concerned about going that direction, thinking that the patients would say, okay, if I'm not spending my entire time of the consultation with the doctor, but more with the technicians, I'm not going to come back to this doctor any longer. And the story tells that this did not happen. So that was a successful decision, but very hard to take at the very beginning.
That wasn't the case. So trust was not eroded at all. If anything, it sounds like trust was augmented.
Definitely was very much augmented, but also the experience that the patients reported to have was way easier in their mind, because they felt that they were, more allowed to ask questions, more allowed to interact, because not to have to deal directly with the one on the pedestal. Going back to the same point.
Wow, that's fascinating. That's fascinating. Who gave you that advice?
Trust who? Guess who? My wife. You know,
I was
my
gonna
wife,
say that. I was
right.
gonna say that. That's
My
amazing.
wife used to work for a company in the United States. I'm not mentioning the company because of,
Sure, sure.
don't
Yeah.
want to make any advice, any kind of, advertising on the company. But she used to work for a major ophthalmic company in the United States, doing practice performance and all of that. So she was the one coming to Italy and saying, hey, you're doing different from the rest of the world. Why don't you try to do something different? And I was fighting with her at some point, telling her, no, I'm going to lose my patients. They will never like it. And so let me tell you also time. I used to spend with my patients for a pre-op consultation for surgery, 45 minutes. Because besides the clinical assessment, I was spending time to them to explain the procedures and blah, 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 all of that. Now, the time that I'm spending with the patients is 10 to 15 minutes. So I reduced this time slot by 2/3. And this was bringing better efficiency. But as I said, most important, a feedback from the patients of, oh, no, I had these great explanations for your staff. This stuff is excellent. And I asked a lot of questions, and I don't have any more questions for you because I already know everything.
You're like, really? Nothing else?
Exactly.
Come on. No, that's
Exactly.
beautiful. I misunderstood what you were saying. When you said guess who, I was like, I thought that's what you said. But yeah, I was gonna say your wife. I mean, hands down. Like
Yeah.
And it's hard, like I was saying earlier, it's hard to change your mind on things, but it's much harder when it's like your spouse.
Exactly. Exactly. It's even more difficult.
I love that. Love that. Well, awesome. Man, this has been so good. I have so many more questions, but I know you have to go and take care of patients. I was just gonna say, you mentioned you were spending a lot of time initially talking to patients and things like that. And I think you've alluded to this throughout this conversation, but your focus has always been first and foremost, be a good doctor. Be a good doctor, right? Know your stuff, take care of people, care for people, right? The
Yep.
business, the entrepreneurship, the technicalities, the logistics, how to improve clinical flow, all of that figures itself out later if you're open to it.
Exactly.
But
That's
none
most
of that
important.
works if you don't have the clinical expertise and you don't care.
Exactly.
And so
And
those
also, if I can add something, if you're more focused on making money
absolutely.
rather than, bringing value to what you're doing.
Absolutely. Yes. And it's so interesting. I've said this before, when you focus on money, people run away. But when you focus on people, the money comes.
Yep.
It's crazy. It's just crazy.
Yeah,
And
that's completely true. Yeah.
Anyway, well, thank you so much, Dr. Carones, for joining us today and just taking some time to talk about entrepreneurship and freedom and what that means as just a lifestyle that you embody day in and day out, not just from a professional standpoint, but from a personal standpoint as well. I appreciate you so much. This was enlightening for me. I think it's going to be enlightening for our listeners as well. Is there anything else that you would like to say as
No,
we?
I just want to thank you because this is excellent, and I'm a learner. I'm going to be a learner for all my life, and I learned a lot from this conversation, and I really appreciate being part of this podcast. So thank you so much.
Well, that's awesome. I thank you. I'm still very early in my career. I finished my residency in 2021, and so I'm a baby. I'm an infant, right? And so I'm talking to someone who has, I mean, I don't know. You've done so much in your career, and I look up to you, and so I appreciate what you've done for our field, and I can't wait for entrepreneurs next year in 2025. Thank you
You
so
already
much.
know the date and time, right? It's going to be
I saw the
April
date.
10 to 13.
Yes, it's on the calendar. It's on the calendar.
So
Thank you, sir.
I'll definitely see you there, if not earlier, somewhere else.
That sounds great. Thank you so much.
Connect with Dr. Shehz at visionarydoc.com.